You're 50 years old. You go in for a routine blood test, and the doctor hands you the results. There it is, a PSA level above 4.0. Immediately, your brain sounds the alarm. Cancer? Do I need a biopsy? Hold on. Take a deep breath. A high PSA does not automatically mean you have prostate cancer. In fact, according to the Mayo Clinic, if your PSA is between 4 and 10, the chance of finding cancer is actually only about 25%. So if 75% of men with an elevated PSA don't have cancer, why is the number so high? And what exactly is PSA? To understand this, we need to meet the prostate. It's a small, walnut-sized gland located just below a man's bladder. Its main job is making seminal fluid. And while doing its job, it produces a protein called prostate-specific antigen, or PSA. Normally, most of this PSA stays inside the prostate, but a tiny, normal amount always leaks into your bloodstream. When your blood test shows a high PSA number, it simply means that something is irritating or disrupting the prostate gland, causing extra PSA to spill into the blood. Here is the golden rule. PSA is prostate-specific, not cancer-specific. So what else annoys the prostate? Number 1 is BPH, or simply an enlarged prostate. As men get older, the prostate naturally grows. Number 2 is prostatitis. This is an infection or inflammation of the gland. A sick, swollen prostate leaks a ton of PSA. Number 3 is physical pressure. Did you know that riding a bicycle for a long time right before your test can bounce your prostate and physically squeeze extra PSA out into your bloodstream? Even certain medical exams can cause a temporary spike. So, your PSA of 4.5 might just be from aging, an infection, or your weekend bike ride. But how do we know for sure? Do we jump straight to needles? In the past, a high PSA often meant an immediate, blind biopsy, a terrifying prospect for most men. But not anymore. Today, modern medicine has smarter filters to double-check things before bringing out any needles. Filter number 1, the free PSA test. Good news, it's just another standard blood test. No extra poking required. In your blood, PSA travels in 2 ways. Some of it is bound, handcuffed to other proteins in your blood. The rest of it floats around completely unattached. This is your free PSA, and the ratio between them is a secret code. Here's the secret. Prostate cancer tends to produce more bound PSA. Benign conditions, like an enlarged prostate, produce more free PSA. So, if your free PSA percentage is high, say, over 25%, your risk of having prostate cancer is actually very low.
But what if it's low?
The multi-parametric prostate MRI. It's a completely non-invasive scan that takes incredibly detailed, high-resolution pictures of your gland. Instead of blindly poking around, radiologists can now literally see inside the prostate, looking for dark spots or suspicious shadows. Radiologists score what they see using the PI-RAD scale, which runs from 1 to 5. Scores of 1 or 2 mean the prostate looks clear. It's highly likely just benign growth. You can often avoid a biopsy entirely. A score of 4 or 5, however, means the MRI spotted a dark, suspicious shadow that definitely needs a closer look. But here is the magic. If you do need a biopsy now, doctors use the MRI image like a GPS system.
Precise and effective biopsy.
Okay, so the MRI and targeted biopsy make the testing much better. But the big question remains, what if the biopsy does find cancer? Hearing the word cancer is terrifying. We are taught that all cancer is a fast-moving killer that requires immediate surgery. Animal number 1 is the turtle. This represents low-risk, slow-growing prostate cancer. And here's a mind-blowing fact. Most of these turtles move so slowly that they will never harm you in your lifetime. Many men die with prostate cancer, not from it. For these turtles, we don't rush into surgery. We use active surveillance. We simply keep a close watch on it with blood tests and MRIs. Animal number 2 is the rabbit. This is intermediate risk cancer. It's moving, and it has the potential to hop out of the prostate capsule. For the rabbit, we need to act. We want to catch it before it escapes. This is where treatments like surgery or radiation come in. Finally, animal number 3 is the bird. This is high-risk, aggressive cancer. It moves fast and wants to fly away to other parts of the body. If we find a bird, we don't wait. We take immediate, aggressive action combining multiple treatments to stop it from spreading. And now it all makes sense. The goal of checking your PSA and getting an MRI isn't just to find any cancer. It's to find the dangerous rabbits and birds early, while safely leaving the harmless turtles alone to live their lives. Because we are so good at sorting them now, the 5-year survival rate for localized prostate cancer is nearly 100%. So, if your doctor says your PSA is a little high, don't panic. You're not immediately facing surgery. You are just starting a smart, modern investigation. Knowledge is power. Always consult your urologist to figure out exactly what your numbers mean for your unique body. Stay healthy, my friends. So, you've survived the PSA panic. But now you might be wondering, what can I actually do every day to keep my prostate healthy and calm? I'm glad you asked. The secret to a happy prostate is fighting inflammation. And your biggest weapon isn't a pill, it's your fork. Meet superhero number 1, lycopene. It's a powerful antioxidant found in red fruits. But its absolute favorite headquarters is the tomato. But here's a pro tip. Raw tomatoes are okay, but cooked tomatoes, like in marinara sauce or soup, are much better. Cooking unlocks the lycopene, making it super easy for your body to absorb. Studies show men who eat lots of cooked tomatoes have calmer, happier prostates. Superhero number 2, cruciferous vegetables like broccoli, cauliflower, and cabbage. They contain a compound called sulforaphane, which acts like a tiny cleaning crew for your cells, sweeping out damaged DNA and lowering cancer risks. But every superhero needs a villain. If you want to keep your PSA down, you need to watch out for heavily charred red meats. Cooking meat at very high temperatures creates chemicals that trigger massive inflammation in the body, making the prostate angry and swollen. Also, keep an eye on excessive dairy. While calcium is good, consuming huge amounts of milk and cheese has been linked to higher prostate risks. Beyond the kitchen, the ultimate free medicine is movement. Just 30 minutes of brisk walking or exercise a day increases blood flow directly to the pelvic region. Think of it like a fast-moving river flushing out stagnant inflammation and toxins. So combine your doctor's modern testing with a prostate-friendly diet and daily movement, and you are building an absolute fortress of health. So, despite the good diet and the MRI filters, your doctor still says you need a biopsy. The anxiety returns. Take a breath. The biggest myth about a prostate biopsy is that it's agonizingly painful. In reality, urologists use powerful local anesthesia. Yes, the position is a bit awkward. You'll lie on your side with your knees pulled up, but it's over in about 10 to 15 minutes. Once the numbing medicine kicks in, you shouldn't feel sharp pain. Most men describe it as just a weird feeling of pressure in their bottom. The doctor uses a thin ultrasound probe to see your prostate. Think of it like a tiny submarine using sonar to navigate. This submarine gives the doctor a live picture, allowing them to perfectly match up with the MRI GPS map we talked about earlier. Then comes the actual biopsy needle. It's spring-loaded, so it moves incredibly fast. In fact, it sounds exactly like a loud office stapler. Snap, snap, snap. They usually take about 12 tiny samples. The noise is startling, but because you're numb, the pain is minimal. And when we say samples, don't imagine huge chunks. A biopsy core is incredibly thin, about the size of a piece of pencil lead. Before you know it, it's done. You can get up, get dressed, and drive yourself home. Most men say the fear was way worse than the actual procedure. Now, let's talk about the aftermath. Don't panic if you see blood in your urine or stool for a few days. It's totally normal. You may also notice blood in your semen. This can look scary, turning it brown or red, and it can last for up to 6 weeks. Again, totally expected. The only real danger to watch out for is infection. That's why your doctor will give you antibiotics. Take every single pill. The procedure is over. Your body heals quickly. But now comes the hardest part of the entire prostate journey, the wait. It usually takes about a week to get your pathology report back. A week where your mind plays tricks on you. Until finally, the doctor calls your name. The wait is over. The doctor hands you the pathology report. You scan the page and your eyes lock onto a strange phrase, the Gleason score. What exactly is a Gleason score? To understand it, we need to shrink down and look through the pathologist's microscope. Normal prostate cells are neat, uniform, and orderly. They form perfect little circles, working together like well-behaved factory workers. Cancer cells, however, are disorganized mutants. The pathologist grades how mutated they look on a scale from 3 to 5. Grade 3 cells are only slightly messy. They still form tiny glands, but they are a bit irregular. Remember our animal friends? Grade 3 cells are the turtles. They are low risk, lazy, and very slow growing. They aren't in a rush to go anywhere. Grade 4 cells are more chaotic. They fuse together into messy clumps, losing their nice circular shape entirely. These are the rabbits. They are intermediate risk, moving much faster, and usually require some form of active medical treatment. Finally, grade 5 cells are complete monsters. They have no structure at all, just wild, aggressive sheets of heavily mutated cells. These are the high-risk birds. They want to spread rapidly and need to be stopped immediately with aggressive treatment. But here's the trick. Your biopsy result is actually an equation. The pathologist finds the 2 most common cell patterns and adds them together. The primary pattern plus the secondary pattern equals your total Gleason score. For example, a 3 plus 3 equals 6. This is the lowest cancer score possible. It means you only have lazy turtles. A 3 plus 4 equals 7, meaning mostly turtles with some rabbits. Scores of 8 to 10 mean dangerous birds are present. Bob looks at his paper. It says 3 plus 3 equals 6. He sighs with relief. Now he knows exactly which animal he is dealing with. So what comes next? Depending on your Gleason score and your overall health, there are several paths forward. The good news? Prostate cancer treatment has evolved massively. It is not the scary, brutal ordeal it used to be decades ago. For our low-risk turtles, the treatment is often active surveillance. No surgery, no radiation. We just monitor it closely while you enjoy life. But if your biopsy shows intermediate rabbits or high-risk birds, we need to actively remove or destroy the cancer cells. If you choose surgery, forget the giant incisions. Meet your new best friend, the robotic surgeon. Controlled completely by your doctor, these tiny robotic arms perform the surgery with superhuman, pinpoint accuracy. This minimally invasive approach means tiny keyhole incisions, less pain, and a much faster recovery time to get you back home. Not a fan of surgery at all. The other highly effective option is radiation therapy. It destroys the cancer's DNA without removing the gland. Modern external radiation uses highly targeted, invisible energy beams that hit the cancer like a sniper, sparing healthy tissue nearby. Alternatively, doctors can use brachytherapy, where they place tiny radioactive seeds, the size of a grain of rice, directly inside the prostate. These seeds slowly release their energy, quietly destroying the cancer cells from the inside out over several months. But Bob has one final fear. What about side effects? Men often worry about losing bladder control or experiencing sexual dysfunction. It's a valid concern, but modern surgeons use nerve-sparing techniques, working meticulously to protect those delicate functions. And with simple pelvic floor exercises, like Kegels, most men regain their full bladder control much faster than they expect. The ultimate goal of modern prostate treatment isn't just to cure the cancer. It's to get you back out there, living your best life. So, let's recap this incredible journey. An elevated PSA above 4 is not a death sentence. It is just a knock on the door. Before jumping straight to a biopsy, Modern medicine uses smart filters like the free PSA test and high-resolution MRIs to map things out. If you do need a biopsy, the Gleason score tells us exactly which animal we are dealing with: a slow turtle, a fast rabbit, or an aggressive bird. And remember, you have the power to protect your prostate every single day. A diet rich in cooked tomatoes, broccoli, and daily movement is your best shield. Thanks to all of this, the 5-year survival rate for localized prostate cancer sits at over 99%. You have every reason to be optimistic. Your prostate gland is a hard worker, and with the right knowledge, you can keep it healthy and happy for decades to come. But remember, no YouTube video replaces real medical advice. Every man's body is different. If you have an elevated PSA, talk to your urologist. Prostate cancer anxiety affects millions of men. Do us a huge favor. Share this video with your dad, your brother, or a friend who needs to hear it. If you found this guide helpful, please hit that subscribe button. We are on a mission to make complex medical science easy to understand. And giving this video a like tells the algorithm to show it to more men who might be secretly panicking about their PSA test right now. Don't forget to ring the bell so you never miss our next medical deep dive. We have tons of amazing body science videos coming up. From Bob, Dr. Smith, and your hardworking prostate gland. Thank you so much for watching. Stay informed, stay calm, and stay healthy. This video is for educational purposes only. Always consult with a qualified healthcare provider regarding any medical condition or treatment. Click the video on the screen right now to learn more about how your amazing body works. See you in the next one.